Good morning, Boston Children's Hospital staff. We are here today with Dr. Mary Beth Pompeo, who is giving us the honor of telling us a little bit about our new Exergen thermometers, and she's going to do a demonstration on how to use it appropriately. So thank you so much for being with us today. I wanted to ask you a question. Tell us just very quickly, temporal artery thermometers, what is it new about them? Why have a thermometer like this one instead of having a regular thermometer?
Because you get a much better reading, excuse me, there's no mucous membranes involved.
Okay.
It's all dry on the forehead.
Okay.
And the temporal artery comes directly from the heart, comes up the side of the face and lands at the forehead. And so by taking the temperature of the temporal artery, we're actually getting a very quick temperature of the blood in your heart.
That's great. What are the parts of the thermometer? Can you show me really quickly what are the parts of the thermometer?
Yes, very simple. There's one button. You keep the button depressed the entire time. So once you start to depress the button, the thermometer is engaged, and it will pick up the temperatures of whatever you're scanning. And then when you let go, the highest temperature that it read will be on the screen.
Okay.
So that's my hand. It's
not the body.
Not my body temperature.
Yeah. What is that? A sensor in there? It's like
there's an infrared sensor in the back of this thermometer.
Okay.
And something that's important that I did many years ago, demonstrating holding the thermometer like this, and the thermometer was thinking that the temperature of my hand was what the patient's temperature was.
Oh,
so
wow.
You want to hold it always by the handle.
So always hold your thermometer by the handle.
Yes.
Excellent. What about this piece right here? How do I clean this off?
You can clean it with alcohol.
Okay.
Most often it's just an alcohol prep. If it becomes very yucky or dusty, or a child starts playing with it and gets gooey all over it, take a Q-tip, dampen it with a little alcohol prep, and then with the Q-tip, just twist it. That's the lens.
Okay.
So it's a camera.
Okay.
So with the lens there, like a camera, the lens has to be clean.
Great. That's really great input. Fantastic. Anything else we should know about the thermometer before you do the demonstration?
Yeah, if you were my patient, before I'd start, I'd just push your hair out of the way, because hair is an insulator.
Is that right?
And if I took your temperature under where your hair is, I'm going to get a fever, and you're going to have to go to bed.
Okay.
Or go home.
Or go home, absolutely. Or if I have patients, we're always screening for sepsis, so that's really important for us to know.
Yeah, you just want to get the hair out of the way.
Get the hair out of the way. Do I have to wait a certain period of time before getting my hair out of the way?
With your hair, because it's very long, I would wait a minute.
Okay.
And that's all. And
Wonderful.
Just hold it back.
Fantastic. Wonderful. So why don't you share with us what is the proper technique for using this thermometer so that everybody can see us?
Okay. When I'm doing children, especially, I will turn the thermometer on by depressing the red button.
Okay.
And then you want to keep it depressed the entire time.
Okay.
You are not body temperature around here with the clothing, so I can press it here and not get your body temperature.
Okay.
I'll get the temperature of your clothing.
Okay.
So I would push your hair out of the way first. At the center of the forehead, I just slide in a straight line over. You can go right into the hair.
Okay, take
and
my
then
glasses
to
off.
make sure that the patient is not sweaty, all the time I've got the button depressed, I do a little tuck behind the earlobe and then let go of it. Look at that.
37.1. Is that good? Yeah, I guess that is good.
Perfect.
That is great. So could you demonstrate one more time so that we can make sure everybody sees the technique?
Okay. Click it off. Press the button. Because you're a child.
Yes.
For now, anyway.
Yes, ma'am.
I press the button first, and it will say scan.
Okay.
And then center of the forehead. Because I just did a temp, it might be a little bit different. But that's okay. Yeah. 37.0. So
Oh,
37.1, 37.0.
Very consistent. Wow, that is great. Well, we're really excited for this technology. Any last minute advice for our friends who are watching today?
I think after you've used it on one patient, alcohol, just take an alcohol prep and just wipe the head.
Okay.
About once a week, you take a Q-tip, cotton bud, dampen it with the alcohol prep. Don't use the alcohol prep then, but just take the dampened Q-tip,
Okay.
twist it
In there.
on the see the little lens
Yes.
here? Think of it as a camera, because infrared is an optical technology.
Okay.
So like a camera is taking a picture of the heat.
So it needs to be clean, just like our phone lenses.
About once a week.
Okay.
You do it, unless somebody does something weird with it, like
Hopefully
stir their ice cream.
All right, Dr. Pompeo.
And then always remember to get the hair away first.
Yes.
Because that way you release the heat from the insulation of your hair.
That is so helpful. All right.
Okay.